This is a story of a first world country bringing first world technology and healthcare providers to a third world country with desperate poverty and a desperate need of a joint replacement. Operation Walk Canada began in 2005, and it began as a medical surgical mission to Guatemala to treat patients with intractable arthritis of their hip and knees by performing artificial hip and knee replacements on these patients. And so we assembled a team, all volunteers, to do this life-changing surgery at no cost. So again, I would emphasize that this is being done pro bono. We have absolutely no paid employees. So everything is done because people want to do it. Guatemala is basically a third world country, and they do their best to look after acute emergencies like trauma, for example, obstetrical care, that type of thing they're going to look after as best they can. But for life-changing chronic conditions such as arthritis, there is really no hope and no possibility that these people would have access to the technology that we need to deal with that. The other thing I would say about this is that many of the Mayan people still swaddle their babies with their legs out straight, and so there's a very high incidence of dislocation of the hip, which then leads to arthritis later on. So many of the people that we're operating are people that do require a hip replacement because of a pre-existing congenital problem with their hips. One of the most extraordinary things that you see when you go there are these deformities that you just don't see in our country anymore. And people that have had really no treatment for anything, and they get to the point where they simply can't walk. It's largely an agrarian economy. So if you can't walk, if you can't get to the field and do what you have to do, you can't put food on the table. So in that sense, it's probably a little more dramatic than what we're seeing here in our own country. A lot more dramatic. The reason we keep going back is really twofold. The first is there's a huge need. I mean, it'd be impossible to satisfy the entire need of the country with what we're doing there. So that's one thing. But the other thing is that the other legacy that we can leave there is education. And so one of the things that we try to do, whether we're a nurse in nursing or physiotherapy or whatever, is to educate the people locally in terms of how to manage these conditions and how to treat them. We do all our surgery in the first 4 days, and during that time frame we'll do approximately 70 surgeries, something like that. Then we stay there after for several days to make sure that the patients have recovered appropriately. We also go back once a year in June to review patients that we've operated before, and then to select patients for next year's surgery. So we're really there twice a year. Many of our donors have actually come there to Guatemala and seen firsthand what's going on there, and it's pretty impressive to see it. And I would have to say that our donors, to a man and a woman and to a corporation, I think have been very well pleased with the way their money's being spent there. One of the very positive things of taking donors to the country, I'm reminded of an event which occurred some years ago. When a donor arrived, we were down in the operating rooms in the hospital, and they were extremely hot. And the donor said to me, "Now, Cease, what's wrong here? How come it's so hot?" And so we found out that the air conditioning wasn't working. And so that donor put in new air conditioning in the entire 4 operating rooms that we have in this small hospital in Antigua. Another donor decided to replace all the anesthetic machines pro bono in this place. And so now the ORs are up to a level that's compatible with what's going on in Vancouver or Toronto or London. We would not be able to do this, quite candidly, without the corporate donors that we have. They give pro bono all the artificial hips and all the artificial knees.
Our team at Smith & Nephew donate between 50 and 100 joint kits, about $2 million worth of state-of-the-art hip and knee replacements.
Total Joint Orthopedics donates 1 implant for every 10 we sell.
That allows us to donate about $2 million worth of implants for every Operation Walk mission we support.
The other thing that I think we need to keep in mind is that it is an all-volunteer organization, and without some of the patrons and donors that we've had that have supported this so generously, we wouldn't be able to carry on with what we're doing.
Operation Walk Canada has decided to come back year after year, and I think we have made a real difference. We think education is the key to what we're doing here. Developmental dysplasia of the hip is largely preventable. And so we talked about DDH and how to treat it early with early diagnosis, early treatment, and to prevent all the problems that we see in adult life.
Maria represents what Operation Walk is all about. We are glad to be here to help.
Todos estamos caminando gracias a Operation Walk Canadá.
So again, thanks to our corporate donors, thanks to our patrons and our other donors, you've made it all possible.
Mi nombre es Melida Cárdenas. Ya puedo caminar. Gracias.